Hi, today I'm going to talk about COVID-19, an emerging infectious disease.
Once upon a time, there was a bat carrying a new virus lived happily in the cave. One day, it went out to seek for food. However, it became the food of humans.
Therefore, coronavirus was born. COVID-19 is a viral respiratory illness caused by the virus.
How does coronavirus attack the body immune system? Once they enter your body through your nose, eyes, or mouth, they travel down your respiratory pathway and reach your lungs. Now, your lungs are infected. The viruses are spreading throughout your lungs and trigger the immune system. On the other organs, they pass through the epithelial cells and bind to the receptor on the cell surface with spike proteins, followed by the transcription and translation of the genetic materials. The host cells are killed, and at the same time, the immune system is activated, but affected by the virus too, on receptor CD147, thus prevent T cells from destroying the virus. However, the immune cells will damage nearby innocent cells when countering the virus. This poses lifelong disability if the cells are destroyed continuously. Mildly infected people can recover by gradually removing the virus and gain the immunity against the virus. For severe cases, a patient has to rely on a ventilator to survive.
What should people do if they are suspected of being infected by COVID-19? COVID-19 testing is needed. Do you have the symptoms such as coughing, shortness of breath, or have you ever been in close contact with an infected person, or have you ever traveled overseas? If you think you may have been exposed to COVID-19, contact your healthcare provider immediately. Through COVID-19 testing, presence of virus itself can be detected, or antibodies produced in response to infection can be detected. Another option is to look for lung damage via CT scan. RT-PCR test is the most common one. A cotton bud will be inserted into your nose and throat to reach the mucus where viruses grow. The specimen is tested using PCR machine and result will be shown within 2 hours to 2 days. Coronavirus pandemic is currently spreading around the world. There is still no vaccines to protect against it. However, medical researchers and scientists are working hard on the research on COVID-19 vaccines. There are few types of vaccines shown below. A biotechnology company named Moderna is trying new technology to produce mRNA vaccine. mRNA1273 is the new discovery of vaccination. So, how does it work? Genome of coronavirus was sequenced and published on public database, and the sequence of genome for key protein called spike protein, which is a surface protein on coronavirus that has antigen that triggers human body to make antibodies when bind to it, was identified. The genetic code of spike protein is then encoded into mRNA. mRNA then replicates and travels throughout the body and activates human immune system. Memory cell will remain in body. The person will be protected when come in contact with actual coronavirus. This new approach is more time-saving. mRNA1273 Phase 1 trial has been carried out on 16th of March, while Phase 2 trial is expected to begin soon.
Roles of statistics in fighting COVID-19. What is statistics? Statisticians analyze and interpret data to draw conclusions regarding social sciences, political science, health sciences, economics, government, history, and so on. In the context of COVID-19 pandemic, what can statistics do? First, the exposure of information to public. Everybody in our society is eager to know the latest news about COVID-19 pandemic. Data such as the numbers of newly infected persons, the numbers of cured patients, and death toll allows the public to have a picture of current conditions. This raises awareness among the public and encourages them to take corresponding prevention measures. Second, economic forecast. Economic forecast is a process of predicting the future economic condition using indicators such as gross domestic product, unemployment rate, consumer price index, bankruptcies, and retail sales. There's widespread agreement among economists that COVID-19 pandemic will have severe negative impacts on the global economy. With the help of statistics, government officials and business managers are able to determine fiscal and monetary policies, plan future operating activities, and minimize the damage brought by the pandemic. Third, statistics as research methodology. Statistics are the cornerstone of any COVID-19 research. Data collected from the infected person helps scientists in understanding the behavior of the virus. Therefore, it's also vital in vaccine and treatment development. Statistics collected may include age, gender, chronic disease, genetic background, eating habits, hospital infrastructure, status of treatment, and a lot more parameters. Statisticians and epidemiologists also play a part to predict the outbreak trend. They give information such as the number of expected COVID-19 cases, mortality rate, the effect of lockdowns, and social distancing measures on flattening the curve. Technology used to track COVID-19. Artificial intelligence play a vital role in the outbreak. First example is Blue Dots that detected a cluster of unusual pneumonia cases that December in Wuhan and accurately predicted where the virus might spread. Another example is the Health Map, a digital map using artificial intelligence and other technologies to constantly track the spread of the novel coronavirus. There are also some coronavirus maps to keep updated the global data. First, Coronavirus Outbreak Map by Johns Hopkins University, the first publicly accessible novel coronavirus tracking dashboard. The website contains the list, tables, sliders, and figures that cite WHO, CDC, ECDC, China's National Health Commission, and the media reports in various countries. CoronaTracker.com consolidates information about the virus from news articles worldwide and credible sources. All the contents are handpicked, filtered, and curated to ensure the sources are reliable. It gathers data for in-depth analysis to monitor the growth and the spread of the virus and localized news related to Malaysia. There are also some apps used for manual tracing. For example, MyTrace suggested by the Ministry of Science, Technology and Innovation Malaysia, a Bluetooth contact tracing app that can keep the data collected for 21 days in user smartphones. The consumer data gathered will be anonymized, and MyTrace was not meant to collect the geolocation information. Next, Trace Together by Singapore government is a digital contact tracing using the Costume Blue Trace protocol that can preserve the privacy of every user. Personal information is only collected once at registration and protected. This app can share temporary identifiers and information about phone models and signal strength between nearby devices. A Bluetooth function could hypothetically help measure whether users were respecting social distancing guidelines in public.